affect healthcare demands, such as whether you're male or female, your age, socioeconomic status, and factors that may affect access to care, such as whether you're living in a rural area or in a region that has fewer healthcare services. And at the same time, we reflected on what we meant by quality care and did look specifically at whether it was accessible, equitable, so that different risk groups were receiving appropriate care, and whether or not there was inappropriate care available as being administered to these individuals. So what did we find? So in a 3-year period, we found that over 90% of our survivors saw a family physician or undertook a test ordered by a family physician at least once, which was almost 50% more visits and services than their peers. We also found, strikingly, that they had 50% increased frequency of visits to different specialists, and I'm going to expand on that a bit. 40% of these survivors had at least one hospital admission, twice as often as the general population, and each of these survivors had more hospitalizations and spent more days in hospital than their peers. We also found that about 90% of survivors received at least one prescription in a 3-year period, and although that was not different than their peers, we found that survivors were more likely to use more prescription drugs and have higher numbers of prescriptions than the general population. And it was interesting to look at the types of prescriptions they had. Some were related to depression, some were